Schizophrenia is a severe psychiatric disorder that causes one to lose touch with reality and disturbs thinking, emotion, and behavior. There are 3 classifications of symptoms for schizophrenia: negative, positive, and cognitive. Positive symptoms include delusions, which are beliefs that are not rooted in reality, hallucinations, which are sensations that lack sensory stimuli, meaning they're not actually real, disorganized speech or behavior, such as saying a random jumbling of phrases or exhibiting bizarre, eccentric behavior that doesn't seem very logical, as well as catatonic behavior, which is a state of stupor or physical unresponsiveness in a person. There are multiple types of delusions. Delusions of grandeur occur when someone believes that they are someone else, like a supernatural figure or a celebrity. Delusions of persecution are when they believe that other people are turning against them. Delusions of reference are when they believe that insignificant remarks are actually intended for them. And delusions of control are when they believe that someone else is controlling their actions. Negative symptoms are classified into the 5 A's. Anhedonia is an inability to feel pleasure. Alogia refers to poverty of speech, meaning their speech is minimal or must be prompted. Avolution refers to apathy, so a lack of interest and enthusiasm. Attention refers to deficits in attention, and affect refers to the flat affect, which is a severe reduction in emotional responsiveness. You may have noticed that the negative symptoms are reductions or removals of normal processes and things that we feel, like interest and enthusiasm, whereas the positive symptoms don't actually have a normal counterpart. If you think about hallucinations, we don't normally have hallucinations. The 3rd classification of symptoms are cognitive symptoms, and these refer to deficits in memory, learning, and understanding different concepts. These symptoms are more subtle and more difficult to actually diagnose. So there are generally 3 phases to schizophrenia. The first phase is the prodromal phase, where individuals may become withdrawn from society and may experience a decline in functioning preceding their first psychotic episode. The second phase is the active phase, where individuals experience severe positive symptoms like delusions and hallucinations. And the third phase is the residual phase. Here, individuals may have a flat affect, meaning a decreased emotional responsiveness, and may also withdraw from society and exhibit disorganized behavior and thoughts. And individuals with schizophrenia may cycle through these phases and have different periods and different lengths for each phase. In order to diagnose schizophrenia, the individual must be presenting at least one positive symptom, meaning delusions, hallucinations, or grossly disorganized speech and behavior, and one other symptom can be either positive or negative. Cognitive symptoms are not a reliable indicator for schizophrenia because they are nonspecific and difficult to actually interpret and diagnose. Additionally, the individual must have been in the active phase for at least 1 month, and the symptoms overall must have been ongoing for at least 6 months. Before we go on to discussing treatments for schizophrenia, I thought it was worthwhile to discuss the specific neurological differences in the brains of patients with schizophrenia. First off, scientists have noticed that the ventricles, which are fluid-filled structures in the brain, seem to be larger in the brains of people with schizophrenia compared to the general population. And they think this is because of a reduction of neural tissue, which leads me to number 2, cortical thinning, meaning that their cerebrum seems to be thinner, especially in the frontal and temporal lobes. Now, the most prominent abnormality that gives us an insight to the cause and mechanism of schizophrenia is abnormal activity in dopamine pathways, specifically the mesocorticolimbic pathway. This pathway can be broken down into the mesolimbic and mesocortical pathways, and these both extend from a portion of the brain called the ventral tegmental area. The VTA is located in the midbrain and is one of the most dopamine-populated areas of the brain besides the substantia nigra. Now, in the mesolimbic pathway, there are dopaminergic projections from the VTA to the limbic system. Abnormal activity here can cause changes in the limbic system that contribute to the positive symptoms of schizophrenia. If you're unfamiliar with the limbic system, this is a set of structures in the brain responsible for dealing with emotions, memory, as well as autonomic functions and reinforcing behavior. The mesocortical pathway has dopaminergic projections leading from the VTA to the prefrontal cortex, and specifically the dorsolateral prefrontal cortex, which contributes to cognition and executive function, as well as the ventromedial prefrontal cortex, which deals with emotions and affect. And we've already seen that the functions of these areas of the brain are affected in schizophrenia, in the negative symptoms. Schizophrenia is a very commonly stigmatized disorder. Many people believe that schizophrenics are dangerous and violent, and although the delusions and hallucinations they experience may be a bit dangerous without proper treatment, most people with schizophrenia are actually more likely to be the victims of abuse or violence rather than the perpetrators. It's also important to study and understand schizophrenia because it is a fairly common disorder. 1% of the general population will develop schizophrenia in their lifetime, so it is essential to understand the disorder even for the general public. Schizophrenia is treated with a variety of disciplines, normally combining antipsychotic drugs with therapy. However, the more that someone with schizophrenia goes undiagnosed while they exhibit symptoms, the more difficult it becomes to treat the disorder. And this is because the more that the individual experiences hallucinations, delusions, and other symptoms that we've talked about, the more that these symptoms become hardwired into their minds. And what the antipsychotics do is that they focus on limiting the positive symptoms by decreasing dopamine activity in the brain. They accomplish this by blocking the D2 dopamine receptors in the brain, which means that less dopamine will be flowing through the neurons and flowing through the brain. And because they're lowering dopamine activity in the brain, they can also contribute to Parkinson's-like symptoms, such as tremors. And if you're unfamiliar with Parkinson's, this disease is caused by a lack of production of dopamine in the substantia nigra, which is located near the VTA in the midbrain. I also have here electroconvulsive therapy, which is a brief electrical stimulation to the brain, and it's used as a last resort. It's not the most common method of treatment for schizophrenia. It's also used in patients with bipolar disorder and severe major depression who have not really been responding to their regular treatments. Another thing that scientists have found about this disease is that 90% of people with schizophrenia smoke cigarettes. And they think this is because nicotine relaxes the rigid nerve cell shape and function in areas of the brain affected by the disease. Now, a few more things to note. Scientists have found that genetics does play a role in causing schizophrenia. So if you have family members with the disorder, you are more at risk for developing it yourself. And if you have that genetic risk, marijuana will increase the chance for the onset of psychosis. Lastly, symptoms usually appear in the late teens or early 20s for men, but the late 20s or early 30s for women, and the exact cause for this discrepancy is currently unknown. But some scientists believe that it may be due to estrogen's role in regulating dopamine levels in women.